So guiding the patients is a two-way street. So this is where the doctor and the patient have to make the decision together. The job of the doctor is to educate the patient well enough to actually make the right decision. And the right decision might differ from patient to patient depending upon their circumstances and their lifestyle choices. So, and with the rising awareness of patient education as well, the patients are becoming competent enough to actually take the right decision. However, the doctor has to educate the patient and leave the options in front of them to make the final choice, because as it is the patient's own body, he would be the right person to take the choice as well. So nowadays, what the doctors follow is evidence-based medicine. So the following would be ideally the steps in which the patient can approach his or her surgery. Step 1 would be consult a doctor to know what the problem is and what the available treatment options are. Step 2 would be where the patient does his own homework, where they read through the available evidence on the procedures that they have been advised on, look at their pros and cons, see the weighted averages of what's good and what's bad for them. And then step 3 would be where they go back to the doctor, talk to them, find out, ask them the fine-tuned questions, the finer questions, and then step 4 would be preparing for the surgery. This would ideally be possible for an elective surgery where the time you're taking for the surgery does not compromise on the treatment efficacy. But if it's an emergency case or where time is of the essence, that's when all of the steps would have to be compressed into a very short time frame where the patient would have to take a quick decision. But as a whole, the treatment process has evolved more into a combined decision-making process rather than an autocratic process where earlier the surgeon used to dictate the treatment options to the patient. And as patients, you don't need to worry about what kind of treatment you're getting. You need to be educated enough to take a calculated risk. And you can always discuss openly with your surgeon or doctor on what treatment options are and what are the pros and cons are associated with each treatment. As a patient, do your homework, read about the surgeries, and ask meaningful questions related to your recovery as well. And then any doctor would be happy enough to answer your questions and then guide you on your decision making and the recovery process. But you only need to be aware of one thing: just don't Google everything, ask them for the sources as well, because just reading anything out of Google which are not verified sources would also actually negatively impact your decision making. So even for that, ask the doctor or your treating surgeon which would be the right source to get the knowledge from, because it is very important from whom and where you're getting your rightful knowledge from.